Now we're going to talk about the bile acid sequestrants. So these are actually second line after the statins, or sometimes they're used in conjunction or in combination with the statins. So this image right here is basically an illustration of the bile acid sequestrants mechanism of action. The liver uses the cholesterol and other chemicals to produce bile acids. And so Welchol, which is basically a bile acid sequestrant or cholestyramine, it binds to bile acids and takes them out of the system, so through the digestive system, and excreted in the form of stools. So when bile acid levels are reduced, the liver needs to take more cholesterol from the bloodstream to make more, therefore reducing the cholesterol level in the blood. Bile aids in digestion and increases absorption of fats and fat-soluble substances such as vitamin A, D, E, and K. The route of excretion for bilirubin, a byproduct of red blood cells recycled by the liver. So bile acid sequestrant prevents reabsorption of the bile acids from the small intestine. So bile acids are necessary for the absorption of cholesterol from the small intestine. It's also synthesized from the cholesterol by the liver. So what's the therapeutic effect? What are we wanting to accomplish from this? So it's to decrease the total cholesterol, and in doing so, it may also affect individual types of cholesterol such as the HDL or the LDL. So LDL is known as the bad cholesterol and HDL is known as the good cholesterol. Indications for bile acid sequestrants: hypercholesterolemia or dyslipidemia. Precautions for these medications: decreased GI motility, and it may bind to other drugs. Contraindications, reasons why we shouldn't give this medication: biliary or bowel obstructions, PKU, or phenylketonuria. So just knowing the mechanism of action, we know that it has to do with the bile acid, the digestive system, and the liver. We expect GI side effects, right? So common side effects for this medication is constipation, nausea, and abdominal pain. It is very important to educate our patient regarding possible side effects. Know that these side effects are sometimes just temporary, sometimes it's just when the patient is newly started on the medication, and usually tends to go away over time. So knowing what we know about the drug, right, about the mechanism of action, possible side effects, how it works, indications, precautions, and contraindications, these are some of our nursing actions or nursing interventions when it comes to taking care of a patient taking bile acid sequestrants. One, we know that this affect cholesterol or lipids, then we want to follow the lipid profile or lipid panel. Second, we need to take caution with other drugs given concurrently because that can affect the absorption or it can have some interaction. Examples of the drugs in class: so there's Colestid or Colestipol, Sequestrant or cholestyramine, Welchol or Colesivam. Those are common medication, and again, the ones with the asterisk, those are the prototypes that we want you to remember for this class.